I guess it depends. Um, I remember very good uh, something that I was taught when I was in med school, and it's everything is a poison, and anything is a poison, and nothing is a poison. It depends on the dose, basically. So we doctors, we try to play with this, with every medication that we use, because if we use it too little, then it's not going to do anything. If we use it for too long, then it's going to probably be toxic or bad for the patient. Steroids uh, have a very, very, very great effect on reducing inflammation, because basically they act in the immune cells, and they don't let those cells move as easy as they usually do. So they take a longer time to get to where the problem is, and therefore this reduces the inflammation, because we have to remember that inflammation is produced by the body as a reaction to something harmful. So by slowing down the immune system, we can slow down those symptoms. But if we do it for a long period of time, of course, we need that immune system to fight some other conditions. So it will eventually produce a little bit of harm. And we have to remember that steroids also can produce high blood pressure, diabetes, obesity. So they do have a lot of secondary effects that we have to accept them, as long as we are giving the patient something better. If risk versus benefit, if benefit is better. So we try to use as little as we can, but unfortunately in conditions like rheumatoid arthritis, which are common, which are chronic, then for some patients the treatment also becomes chronic. With osteoarthritis, we try not to, we don't use them as much. So sometimes we do it for short periods of time, or just one intra-articular shot once in a while, once or twice a year. So that's not a big problem. With rheumatoid arthritis, we are developing new medications that help, or that slow down the immune system as good as corticoids or steroids, without the secondary effects. But unfortunately, it's so good and sometimes so cheap that for some patients, this is the only medication they can use. So we see normally in our office patients that have been using steroids for years without stopping, which is not the ideal, but that really improves the life of some patients. So you will see that.
And complementing the answer, for example, in rheumatoid arthritis, we have like 2 stages in the disease. We can have an active disease, or we can have a disease remission. It means that the symptoms are completely controlled. Normally, in an active disease, maybe you will need for a period of time, a short period of time, steroids and DMARDs in junction. But in a disease that is in remission period, maybe you will need just even no treatment for a period of time. But yes, that's the change of the treatment. And no single treatment works for all patients. In rheumatoid arthritis, many people must change their treatment at least once during their lifetime of the disease.